What if I told you that a simple habit, one that requires no medication, no prescription, and no expensive equipment, has been scientifically shown to reduce your risk of Alzheimer's disease by up to 65%? A landmark 20 years Finnish study tracking over 2,000 people found this one habit to be one of the most powerful lifestyle intervention we currently have against dementia. And most people are completely ignoring it. Stay with me because in the next few minutes I'm going to tell you exactly what this habit is, what the science says, and how you can start today. Welcome back to the channel. I'm Nurse Emmy, a qualified nurse, a microbiologist, and an health educator dedicated to breaking down health topics in simple everyday language. If you are new here, welcome. Hit that subscribe button and turn on notification so you never miss a video. Today we are talking about one of the most exciting piece of health research making waves right now: the powerful connection between sauna use and Alzheimer's prevention. Let's break it down. What is Alzheimer's disease? First, let's quickly understand what Alzheimer's disease actually is. Alzheimer's is the most common form of dementia, a progressive brain disease that destroys memories, thinking ability, and eventually the ability to perform simple daily tasks. It affects millions of people worldwide and currently has no cure. The sixth leading cause of death in the United States. As we get older, our risk increases, and with an aging global population, Alzheimer's is becoming one of the most significant public health challenges of our time. This is why any evidence-based lifestyle intervention that reduces the risk, especially one as simple as sitting in a sauna, is genuinely groundbreaking. Now let's talk about the science. The findings come from the Tokyo Ischemic Heart Disease Study, a landmark long-term study conducted in Finland tracking 2,315 middle-aged men who used the sauna only once per week. A landmark long-term study conducted in Finland tracking 2,315 middle-aged men over an average of 20 years. The results were extraordinary compared to men who used the sauna only once per week. Men who used the sauna 4 to 7 times per week had a 66% lower risk of dementia and a 65% lower risk of Alzheimer's disease specifically. Let me say that again. 65% lower risk of Alzheimer's disease, and this result held true even after controlling for other lifestyle factors like age, alcohol consumption, body weight, blood pressure, cholesterol, and smoking. A second and larger study of nearly 14,000 men and women followed for up to 39 years found that people using the sauna 9 to 12 times per month had a 21% lower risk of dementia compared to those using it less frequently. This is not a small study. This is 20 to 39 years of real-world data. So how exactly does sitting in a hot room protect your brain from Alzheimer's? Scientists have identified several fascinating mechanisms. Mechanism number 1, cardiovascular benefit. Sauna exposure has been shown to closely replicate the cardiovascular benefits of moderate intensity aerobic exercise. It raises your heart rate, improves blood flow, and enhances vascular health, and brain health are deeply connected. A healthier heart means better blood supply to the brain. Mechanism 2 is heat shock. Proteins. When your body is exposed to heat stress, it produces special protective protein called heat shocked proteins. These proteins act like cellular bodyguards. They protect the brain structure inside your body from damage and prevent the harmful protein clumping that is a key feature to Alzheimer's disease. And mechanism 3 is reduce inflammation. Chronic inflammation is strongly linked to Alzheimer's development. Regular sauna use has been shown to significantly reduce inflammatory markers in the blood. And the fourth mechanism is BDNF production. Mechanism 4 is BDNF production. Sauna use stimulates production of protein called brain-derived neurotrophic factor or BDNF. BDNF is essentially fertilizers for your brain. It promotes the growth of brain cells and supports memories and learning. The fifth one is stress reduction. Chronic stress is a known driver of cognitive decline. Sauna use activates the parasympathetic nervous system, promoting deep relaxation and significantly reducing stress hormones like cortisol. Now you are probably asking, what kind of sauna and how often? The studies were conducted using traditional Finnish saunas, heated between 80 and 100 degrees Celsius with dry air. Sections lasted approximately 15 minutes on average. The sweet spot based on the research appears to be 4 to 7 sections per week for maximum benefit. However, even 2 to 3 sections per week showed significant risk reduction. Now I know what you are thinking. What if I don't have access to traditional sauna? Research suggests that hot baths and infrared saunas may also offer some similar benefits through its stress mechanisms. Though the specific studies of Alzheimer's prevention used traditional Finnish saunas, hot water immersion has been shown to more than double core body temperature rise compared to traditional saunas, potentially offering strong benefits. If you have access to any of these regular heat therapy, it is a worth exploring. Who should be cautioned? Before I get too excited and you all run to the nearest sauna, as a nurse, I have to give you the important safety information. Sauna use is not suitable for everyone. Please avoid sauna use or consult your doctor first if you have unstable heart disease or recent heart attack, very low or very high blood pressure, you are pregnant, you have kidney disease, taking medication that affects your heart rate or blood pressure, or if you have been drinking alcohol. Always stay well hydrated before and after a sauna section. Listen to your body. If you feel dizzy, faint or unwell, get out immediately. And always consult your doctor before starting regular sauna section if you have any existing health conditions. Before we go, let's recap what we covered today. A landmark 20 years Finnish study found that using a sauna 4 to 7 times per week reduced Alzheimer's risk by 65%. The mechanisms behind this include cardiovascular benefits, heat shock protein production, reduce inflammation, BDNF, brain growth reduction. The recommended section are 4 to 7 times per week at 80 to 100 degrees Celsius for approximately 15 minutes. Hot bath and infrared saunas may offer similar benefits. But always check with your doctor first, especially if you have existing health conditions. Alzheimer's currently has no cure, but the science is telling us it may have powerful prevention tools, and one of them might be as simple as sitting in a room of it several times a week. So if this video genuinely surprised you, please give it a thumbs up and share it with someone who has a family history of Alzheimer's or dementia, because they need to hear this. Subscribe for more evidence-based health education every single week. Drop a comment below. Do you have access to a sauna? Will you try this? I read every single comment and I would love to hear from you. I am Nurse Emmy. Take care of yourself and your brains.